Hi, I'm Melinda. This is Roger, beginning my health assessment exam on him. I have washed my hands upon entering the room and performed his vitals, which were weight 226, height 5'11", blood pressure 125/71, pulse 69. I'm noticing his facial expression, which is appropriate. And I will begin by looking at his head, which is round, symmetrical, normal, cephalic. Then I'll begin palpating his scalp, looking for any lumps, lesions. It's normal. Normal hair distribution. Any tenderness noted? Any tenderness?
No.
Okay. Normal hair distribution, no alopecia, good hair texture. Moving down to the temporomandibular joint, open and close. Okay. No decrepitations noted, no tenderness. Looking at facial symmetry by looking at the eyebrows, the palpebral fissures, nasolabial folds, corners of the mouth, which are all symmetrical. Then I can check for cranial nerve number 7 by getting you to frown, smile. Close your eyes and hold them, okay? Puff out your cheeks, okay? And that's checking cranial nerve number 7. Next, I will be checking his vision, and this is visual acuity by checking this using the Snellen chart, if I can get you to see. And get you to cover up one eye, read the smallest fine print line you can.
I think I'm reading number 7. It's PELDPZD.
Okay, go up to 6.
EDFGZF.
Go up to 5.
PEGFD.
Go up to 4.
LPED.
Okay, cover up the other eye. And go down.
7. FLEOPZD.
Okay. The left eye. Okay, you can have a seat. Left eye is 20/50. The right eye is 20/25. And that is checking visual acuity. Next is checking confrontation. Visual fields. I'll cover up one eye. You cover up one eye. You let me know when you see my fingers wiggle.
See it. See it. See it.
Okay, cover up the other eye.
See it. See it. See it.
Okay. All right. Next, I'm checking extraocular motor muscle function by checking cranial nerves number 3, 4, and 6. Look straight ahead. And the cornea, the light is shining on both corneas equally. Okay. Next, we'll be checking the pupillary light reflex. I'll get you to stare straight ahead. Okay, and the pupils are reacting briskly, symmetrical, and with both eyes. Okay, next I will be checking for accommodation. Just look straight ahead. I'm going to hold up a finger and I will tell you when to look back. Okay, look at my finger and look at the distance. And the pupils are dilated, looking in the distance, and look back at my finger. And dilating, symmetrical. Okay. Next, I'll be looking into the eye, and I see the red reflex. I see the ocular disc, which is creamy yellow, the physiological cup, which is lighter darker yellow. I see the veins and the arteries with no crossing or AV nicking noted. And same in both eyes. Okay. Next, I will do the 6 gazes. I want you to look straight, follow my finger, and don't move your head. Okay. Symmetrical parallel movements. There's no lid lagging or no nystagmus noted. Next, I'll be looking at your eyebrows. Normal hair distribution, no lesions noted. I'll look at the eyelids, eyelashes, which are outward, and there's no swelling or redness noted or drainage. I'm going to check and just look down. Open your eyes, look down. I am checking his conjunctiva, which is pink, and the sclera, which is white. Looking from the sides of his eyes at his cornea, which is clear, smooth, and no opacities noted. Okay. All right. And each pupil is round, regular, and reactive, and each iris is even color distribution and flat. I am checking the lacrimal apparatus. Any tenderness?
No.
Okay. All right. Then looking at the ears, checking to make sure they're symmetrical, and feeling for any lumps or lesions, any tenderness. I'm pulling on the pinna, pushing on the tragus. Okay. All right. And I'm going to be looking into the ear. Okay, I see redness or drainage noted. I see the tympanic membrane, which is translucent, pearly gray, with the light reflux anterior inferior quadrant. No perforations noted. And the same in this ear. And then looking through the tympanic membrane, the umbo, the manubrium, and the short process is visible. And also I am checking filling of the mastoid with no tenderness noted. Okay. Next, I will be checking the acoustic cranial nerve, and I will get you to put a finger in your ear. I will whisper, and you let me know if the words that I am saying. Go ahead and put it in that ear.
Kara. Jeffrey.
Okay, do the same. This ear.
Baseball. Melinda.
Good, good. Okay, next I will be checking. This is also checking acoustic nerve. This is called the Weber test. I will place this on your top of your head. You let me know if you do hear it in both ears.
I did hear it.
Okay. Next, I am checking the Rene test. I will place it on your mastoid behind your ear. You let me know when you stop hearing that. Then I'll place it in front of your ear. You let me know when you stop hearing it.
Stop hearing it. Stop hearing it.
Okay. Again.
Stop hearing it. Stop hearing it.
Okay, and that does prove that he is able to hear it longer through air conduction. Okay, next, it's like I am checking your nose. I'm looking for any lesions noted. It is midline symmetrical and the same color distribution as the rest of the face. I will be looking, hold your head up, looking into the nasal mucosa, which is pink. No drainage noted, moist. Looking at the nasal septum too, in both sides. There is no polyps noted in either side. I'll check for patency. I'm going to occlude one, breathe. Okay. Okay. All right. Now checking your cranial nerve number 1 olfactory. I'm going to get you to close your eyes and you tell me what you smell.
Smells like some type of alcohol.
Okay.
Coffee.
Okay. All right. And I will be feeling or palpating for any tenderness over your frontal sinuses. Are there any pain? And here, any pain? And the maxillary sinuses. Okay, next I will be going and looking at the mouth. And it is symmetrical with no lesions noted. Pink, smooth, no cracking. Open up. And the teeth are normal distribution. No cavities noted. Buccal mucosa is pink, smooth, no lesions. Underneath the tongue is normal veins with no lesions noted. Stick out your tongue, please. And this is checking for cranial nerve number 12, which is the making sure that the tongue is not deviated or has any tremors. Next. Open up. I see the tonsils. They are +1. The hard palate is irregular with white. Soft palate is pink, movable, and smoother. Okay, and I will get check cranial nerve number 9 and 10. I'll get you to say ah. And the uvula moves up and stays in midline. I will not check the gag reflex, but that is also checking cranial nerve number 9 and 10, and I will not perform that. Okay. Next, I will check your neck, looking at some symmetry, and it's symmetrical. I see no abnormalities, just normal pulsations. It is in midline. I'm checking the trachea, which is midline, symmetrical. Okay. I'm going to check your glands. This is submental, submandibular, preauricular, postauricular, occipital, superficial cervical, posterior cervical, tonsillar, show your shoulders up, and supraclavicular. Okay? All right, and there's no abnormalities noted. I'm going to get you to take a drink. I'm going to watch his neck for any thyroid abnormalities. The tissue of the thyroid does go up on swallowing. I'm sorry. Okay, next I'm going to stand behind you and we'll get you to take a swallow, but hold it. Wait just a minute, and I'll tell you when to swallow. Okay? Okay, and there is no palpable thyroid that is noted on the exam. Okay, next I will be looking at your chest and checking the back of the chest. The AP diameter is less than the transverse. I'm looking at the respirations, which are even, and I'm going to be checking for any lesions. The skin is warm to touch and good skin turgor, and I'm going to be checking the chest expansion, and I'll get you to turn that way a little bit. Turn on around, please. Okay. Now, I want you to breathe in and out. Okay. Again. Okay, and that is symmetrical, checking the chest expansion. Next, I'm going to be feeling of the spontaneous process, and it's symmetrical and alignment. I'm going to be checking for any tenderness, palpation. Stand up straight. I'm going to be checking for CVA tenderness. You let me know if this has any pain. Any?
No.
Okay. Next, I'm going to be doing percussion. Which is resonance over all the lung fields. Okay, next I will be checking for diaphragmatic excursion. Which is the same on both sides. Next, I will be listening. Take deep breaths in and out. Okay, and there's no adventitious sounds heard in all lung fields. Okay, all right. Oh, and I need you when I say 99. When you feel me press on your back, I want you to say 99. I'm checking tactile fremitus for listening or feeling for vibrations. All right, say 99.
99. 99. 99. 99.
Okay. All right. Next, I will be looking at the anterior chest. It is symmetrical, even respirations, good skin color. No lesions noted. Costal angle is 90 degrees. Thorax is symmetrical. I will be checking tactile fremitus. So
99. 99. 99. 99.
Okay. All right. Next, I will be percussing. Okay. Next, I will be palpating for any tenderness noted. Okay. And none noted. And next, I will be listening. Breathe normal in and out. Okay, all right. Next, I will get you to then I will check your diaphragmatic excursion. I'm sorry, your chest expansion. Okay, breathe in, out, in, and that is symmetrical. Okay. Then I will get you to lie down. Okay. Let me pull this out. Okay, I'm looking at the neck vessels for any abnormalities. There's no jugular vein distension noted. I will palpate each carotid, and one side at a time. And I can listen for any bruise with the bell. Breathe in. And hold it. Okay? All right, put your arms down by your side. Okay? Next, I'll be looking at the arms and checking the radial pulse. And the brachial. And they're +2 and equal on both sides. Next, I will be looking, doing the abdominal assessment, and that is first looking at the color, this shape, which is flat and even color, no lesions noted, no abnormal pulsations noted, and then I will begin listening for vowel sounds. Normal vowel sounds noted. Next, I can check with the bell for the aortic artery for any bruise, and the renal, and the iliac, and the femoral. Okay, the umbilical is no lesions noted, no hernias. It's inverted and normal skin color. Next, I will percuss, and I hear tympani. Okay, I'm checking for liver dullness, which is noted, and I'm also checking for splenic dullness on the mid-axillary line. Okay? All right, next, you let me know if you have any tenderness. I do light palpation. And deeper palpation. Any tenderness? No?
No.
Okay. All right. I'm palpating for the kidneys. Take a deep breath. Okay. All right. And I'm palpating the liver. Take a deep breath and let it out. Okay. And the spleen, same, in, out. Okay. And the liver and the spleen are non-palpable. Okay, next, I will check your legs. Okay. All right. They are normal distribution, normal hair distribution. They're symmetrical, no atrophy or swelling noted. I will check for tibia swelling in both. Checking for temperature in both, and they are warm. Okay. All right. Let me check your heart. First, I look at the precordium and check for the apial pulse, which is at the 4th or 5th intercostal space, mid-clavicular line. I palpate in the apex and the base. There's no pulsations or thrills noted. Then there's no lifts or heaves noted. I'll be listening to the apical, pulmonic, Erb's point, tricuspid, and mitral valve. S1, S2 normal heart sounds are noted. I will check for any murmurs by listening. Same points with the bell. And no abnormalities noted. Apical pulse 60 and regular. Alright, let me get you to turn on your left side. And I will listen the same for any abnormal heart sounds or murmurs. Okay, alright. Now lay back on your back. While lying here, I will check his hands, fingers, good capillary reflux, 1 to 2 seconds. The nail angle is 160 degrees, no clubbing noted. Good skin turgor within the arms. Okay. All right, let me get you while you're lying there. I'll check cerebellar function. I'll get you to raise this leg up and take your heel and move it down your leg. Okay, all the way. And that's checking cerebellar function. Okay, good. All right. I will check your popliteal pulses in both legs. Okay. And your posterior tibia. And dorsalis pedis. And they are +2 and equal bilaterally. Okay. All right. Then I will be checking for any varicosities noted, which is normal. Let me check your range of motion while you're lying there. I will get you to raise your left leg straight up. Okay, good. And raise the right one. Okay. Now I'll get you to bend your left knee and raise it up. Okay. And the same with your right leg. Okay. All right. Now, if I can get you to raise your foot up. Okay. And the left foot. Curl your toes. Okay. All right. All right. Now I'll get you to set up. And checking cranial nerve number 11, spinal accessory. Let me get you to shrug your shoulders against me. Okay. All right. Like that. Okay. Go up. Okay. All right. Now I will get you to go look to the left against my hand with resistance. Okay. Same way here on this side. Push. Okay. All right. Range of motion on your head. Look back or raise your head backwards. Okay. Look forward, to the left, and to the right. Okay. Now I'm going to check your reflexes. Check the okay. Checking the biceps. Okay. Checking the brachioradialis, just relax it. Okay, the triceps, just let it relax. Okay. Biceps. Triceps. Brachioradialis. Okay. And patella. Okay. All right. And your Achilles. Just relax. Okay. And your plantar. Okay. All right. Good. All right. Next, we're going to, I want you to stand. Okay. I will get you to walk in a straight line. Okay. Come back to me and do heel to toe. Okay. Now walk on your toes. Walk on your heels. Okay. Now we're going to check. I want you to stand by your side. Hands by your side. Okay. Close your eyes. I'm checking Romberg, and close your eyes. Okay. And it's negative Romberg because he is swaying a tiny bit, but not moving and off balance. Okay, you can have a seat. Okay, let me do some other neurological exams. Tell me the day of the week.
Saturday.
Okay. What's your date of birth?
December 6, 1944.
And what is the President of the United States?
Barack Obama.
Okay. All right. Now, let me do some vibration on your foot. Do you feel that?
Yes.
Okay, that's vibration test. And I'm going to do sensory test on you. I'm going to push sharp end and a dull end. You let me know if you do feel dull or sharp. Okay? All right. Close your eyes. This is
Sharp.
dull and this is sharp. Okay?
Mm-hmm.
Go ahead.
Sharp. Dull. Sharp. Sharp. Dull.
Okay?
Sharp. Sharp. Dull.
Okay?
Sharp. Sharp. Dull. Dull.
Okay.
Sharp. Sharp.
Okay. All right. Next, checking your facial nerve. I'm going to you tell me if you feel this. Close your eyes and tell me. Let me know when when I'm touching you.
Touching me. Touching me. Touching me. Touching me. Touching me.
Okay. All right. Next, I'm going to place something in your hand. It's called stereogenesis. You let me know what it is that I'm placing in your hand. Close your eyes. Okay. Close your and tell me what it is.
Cotton, isn't it?
Okay. All right. Next, I'm going to draw a number in the palm of your hand. You let me know. This is graphophasia. You let me know what the number is.
1.
Okay. Good. All right. Let me go ahead and discuss the breast exam, which is male or female. First, I get the client or patient upright like he is. I'll first do a visual looking for any lesions, discharge noted. Then I will get them to raise their hands, arms up above your head, and see if there's any abnormalities noted. Make sure it's symmetrical. Then I get the patient to place their hands on their hips to see if there's any abnormalities. Next, I check for nodes in the axilla area into the arm, all the way out into the arm, up into the axilla and the alonospins, or tailespins, I'm sorry, with both the arms. Next, you start a circular exam, starting you can from the outside going inward or inward going outward. Then you check the nipple and areola for any discharge noted. This does conclude my assessment today.